Hello everyone, welcome back to my YouTube channel. If you're new here, hello, welcome. So this video is going to tell pros and cons of being a physiotherapist, at least from the experience that I've had so far. So just so I don't leave out some points, I'll be using my phone. I have an outline of what this video will be all about. So what are some of the benefits? What are the positives of being a physiotherapist in Nigeria, and what are the negatives? I don't think it only applies to Nigeria. I think it also applies to other countries. The pros. One thing I'll tell you is the early earning benefits. You're coming out of university, you already see some of your friends and people you started school with, and those graduating, they are already like panicking. Oh, I have to start looking for a way to make money. But the thing is, you are already doing your 1 year internship and you're already getting paid. So while other people are trying to like look for a way to start generating income, you already have one. You're already starting to get your salary. And aside from that, even after finishing your internship, physiotherapy work is in high demand. So even if you've never gotten employed in a hospital or an organization, you can actually start your private practice. Now you have that person in charge that is mom or dad has stroke, or you have someone that just had a fracture, and then they say, oh, please, can you, my parent needs the services of a physiotherapist. I don't want to take him to the hospital because of traffic or the stress. Yes, you can go to their house and start working as a physiotherapist and charge and start getting paid. So even after internship, you don't have to start carrying your CV and looking for a job. You can actually start working on your own and getting money. Imagine having like 2 3 patients that you're seeing, and you're seeing them maybe twice in a week, and you're alternating it. You are getting paid per day, and you can imagine how much you're making per week and then per month. The second pro for being a physiotherapist for me is room for growth and specialization. Now, having been through the different specialties during your internship, during your undergraduate days, you should have started having an idea of what you want to specialize in. And even if you don't want to specialize, you can continue shuffling between the different specialties, especially since you already have the knowledge of it. But let's say you want to specialize. Yes, you might decide, okay, pediatrics is not for me. I don't like the way the babies cry. They're so loud. So you might think, okay, I think musculoskeletal orthopedics is for me. Yes, you can branch out and do that. It is not so restricted. This is the part that suits me. This is the part I enjoy, and I'm just going to follow this part and start to specialize in this part. So you could go do your master's maybe in orthopedics or sports, or and just start to grow as a physiotherapist. Third pro for me is it teaches you empathy. You learn to care for people. It teaches you some good characters like patience. In a unit like pediatrics, and you are dealing with children that are facing delayed developmental milestones, children that should have been working, talking, sitting, and they can't do this. You keep doing physiotherapy treatments for them, and then it takes a while for you to start seeing results. So you can't be in a hurry. It teaches you how to be patient. Same thing with the neurology unit. It takes time for you to start to see results, and let me tell you, by the time you finally see those results, the joy that you get, because you know you've been putting in this hard work over time, but you have to remain patient, you have to remain calm. It shows you compassion, because imagine your patient keep paying for this treatment session and it's taking so long. So there is empathy, you help and you care for people. It makes you see, it gives humanity a new perspective to you if you're not wicked. Fourth point, which tallies with the third one, it is very rewarding. As a Christian, I know that some of the things we do, our reward is in heaven. You get rewarded for it, and sometimes you might even get rewarded right on earth. Yeah, so you're treating a particular patient, and you're living, and sometimes some of the caregivers or the patient themselves, they feel so happy with their results, and then they are going by and they're like, oh, take this money, use it to buy food, use it to do this, blah blah blah. So you get some little rewards like that aside from the heavenly reward, which is good. So you get tips from time to time. The fifth pro for me is you make connections, you meet people. There are some people that walk into your clinic that you would never have thought you would see, or you will meet, or you even have the opportunity to even move close to. But because of this profession, you start to make connection, meet people. Imagine if Charles actually did his ACL surgery in Nigeria, and then imagine I was the one working in that hospital, and I was the one assigned to take care of his case. That's how I would have met Fowles. Yeah, so something like that. So it's so easy to also meet people and make connections. I'm not saying you should start meeting them and start begging for money. No, please, no. Just saying it gives you the opportunity to meet people that are highly ranked or like celebrities, which could be a good feeling sometimes. 6 point. I'm going to say this last because it could be a pro and it could also be a con. So for physiotherapy, being a physiotherapist, you have to keep learning. So if you're someone that enjoys reading, you're someone that likes acquiring knowledge, yes, it is a pro. If you're someone that is lazy and you just feel like, okay, once I'm done with school, I don't want to read again, then it is a con. No, 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 no. Maybe this is not for you because as a physiotherapist, you keep reading, you keep improving. Like as I said, we do evidence-based treatment. So you have to move with time because some treatment that you were doing previously, research can come and say, okay, no, this is not what should be done. You have to change the technique. This way is better, will give your patient a better result. So you have to keep reading, improving yourself. You still need to remember your anatomy. So, and to do that, you need to keep refreshing your knowledge. Let's talk about the cons of being a physiotherapist. The first con is tuition is so expensive. Now, I've been trying to do my master's and I've been rethinking it. I want to do a doctorate in physical therapy, a DPT. And then the money I'm seeing in the US, you're seeing $30,000, $40,000. Oh my God, it is expensive. Even in federal universities in Nigeria, when some of your mates are doing courses that is just like 40K, 50K, and you as a physiotherapist, you're offering courses that is charging like, let's say, 140K because of the professional level and all of that. Then the books you get to buy, your word code, some of the instruments you'll use and all of that, your scrubs. So it can be expensive. So if you're someone that don't want to spend, although any money spent is value given to the education you're going to get, but it can be expensive to study in Nigeria. Second con. If you don't like working out or if you're not strong enough, I don't think this is for you because there are sometimes you will see patients and you would have to lift, you would have to carry, you have to be strong, you have to be fit to do some of the techniques, some of the treatments you offer to the patient. You can't be telling the patient, okay, to do one particular exercise and you yourself as a physiotherapist, you cannot do it. Or then you have to lift a patient and you're teaching a patient how to ambulate and then you're not strong enough to carry the patient. So yes, you have to stay fit. I know some people be like, but not everybody works out. Yeah, you might not work out, but you have to be fit as a person. Your endurance level has to be high. You must be strong to some extent. But that should not discourage you because I've seen some people who are small and they are able to handle patients. It also depends on your skills and technique. There are some skills that would help you carry patients easier or lift patients easier. Yeah, and that also leads me to you would develop some back pain sometimes. Like you're treating a patient to stop back pain, and then you yourself at the end of the day, you're like, "Ooh, my back hurts," because it can be so demanding physically. And the same way demanding physically is the same way it can also be demanding emotionally. So I think I'll use that as my third con. If you're someone that gets emotional easily, it can be funny sometimes. There's some cases and some conditions you'll see, and this will just strike you. It will strike your heart. It gets you so emotional. You're like, why? Especially in pediatrics for me, like, oh, this child is so small. Why does he have to go through all this? The pain. I think it's one of the reasons why I don't think I can be a pediatrics physiotherapist. Like, it's just so emotional. Like going to the ward, seeing these babies, and then you're doing treatments back to back, and then it takes a while to even see like a significant difference, so it can be really sad. So it can mess you up both physically and emotionally. Another con is the documentation. So it's one thing to treat a patient, it's another thing to document the treatment. Oh, especially during your internship where you also have to click and you have to write out all the details. Then after clicking, you also have to do your treatment. And imagine you're clicking like 3, 4 patients and then you have to do the documentation. You keep writing and writing and writing, and you cannot miss out any treatment. So you should always make sure it's documented. But the good thing is now, where I work, we have this software with the patient's record and all. So most times when the doctors have seen before they refer to a physiotherapist, you already see some of the issue and see some of the documentation. But you as a physiotherapist, you still have to document. But this time, instead of writing repetitively, you can just do your clicking. But it's still the same actually because you still have to type. Now that I think about it, it's the same. But the good thing is you're just typing. So sometimes you can just, yeah. So the good thing is you are just typing. It's pretty much the same. That one is just writing, this one is just typing. But you have to always document your treatment. So if you're someone that you don't like to scribble stuff or write or type, well, get ready for it. If this is really what you want, you're going to document, and you have to document well. This coin is very important because I'll tell you, as a physiotherapist, you can't be rich. Don't quote me. If you're doing physiotherapy alone, if you're a physiotherapist alone and you don't have a side hustle or you're not doing something else, it might be difficult for you to get rich, but you'll be comfortable. You'll be comfortable, you would have shelter, you would have food to eat, you'll be able to move around, but you cannot be rich. And rich to the extent that, I mean, you want to live the baby girl life, you want to travel, you want to book your flight, you want to no, it might be a bit difficult because you're doing so much, it can be time consuming. So you're working like hours, 40 hours a week. And the pay you get, honestly, I don't think is equivalent to the work we put in, if I'm being honest. So you can't really be rich. Yeah, I don't think you can be rich except you're doing something else. So except you have like a private business or you have another business. That's why I have a business. I do small chops. By the way, please check out my business, Kills Treats. So I make small chops and grills. So you have to have a side hustle. You have to be doing something so as to generate more income. Then talking about being rich, I think we should also talk about promotions and the money you get. So it takes a while for you to get promoted up the cadre, especially if you're working in like a public sector, you're working for the government. So that it takes a while to get promoted, and even when you get promoted, the pay rise is not really so significant. And trust me, as time goes by, let's say you started working and you were single, now you've worked 2 3 years and then you're preparing for your promotion, but now you're married, you have a kid coming on the way, your wife, you're paying rent, you have to buy a car because now you're expecting a baby, and then you finally get promoted, but the money is still almost insignificant because even the money we were managing when you were single was not enough. Now you have to cater for, let's say, your wife or your family and your baby. So the money is not, that's why I said you can't really be rich. You can just be comfortable. Yeah. Another con, and this is very personal to me, is you can't really be so flashy. You can't really fix nails. You can't be too out there doing heavy makeup, lashes. You have to be subtle. Even if you paint your nails, you have to like tone it down. You need to be professional. Some people even say the perfume you use, it shouldn't be so strong that it will choke your patient. It has to be mild. So if you're someone that you like to like go out there, you like your nails long, like Cardi's own, it might not be the one because how do you want to mobilize or manipulate? Now, when I was in 100 level, 200 level, when I entered you, I used to love jewelry so much. I used to have like all these big earring loops. I have like bracelet, wristwatches. I even used to do makeup then. But like when I crossed over to clinical in 300 level, like I had to mellow. You have to keep it professional. I'm not saying you can't do makeup. Yes, you can do your makeup. You can keep your nails nice and short, neat. I mostly use press on nail because if I think about getting my nails fixed, like how do I want to work during the week? If I even fix my nails, probably just going to be for the weekend, which is Saturday, Sunday. So press-ons are my own thing, and you can't be too flashy, honestly. But I don't think the cons are so bad. I think the pros might just outweigh the con. Like I said, physiotherapy is so rewarding. I enjoy doing it, and I hope you get at least an idea of what it's all about, and then you can make a decision if this is what you want and if this is your part. Please do not forget to like, to share, and to subscribe. Please subscribe. Let us grow. Thank you all for watching. It means so much to me. Love you, lovelies.